Good evening, everyone, and thank you for joining us. As we begin this event, Dalhousie formally acknowledges that we are here today on traditional Mi'kmaq territory. We are all treaty people. We also recognize the histories, contributions, and legacies of the African Nova Scotian people who have been here for over 400 years. I'm David Anderson, the Dean of Dalhousie Medical School, and I'll be moderating tonight's panel. I'm pleased to welcome you here tonight to the first of many events the Faculty of Medicine will be hosting in partnership with the McEachern Institute for Public Policy and Governance at Dalhousie. Bonsoir et bienvenue à tout le monde. J'ai le grand plaisir de présenter les médecins hygiénistes en chef de 4 provinces atlantiques pour discuter des leçons de la première vague de la COVID-19. With over 33 million cases worldwide and over 1 million deaths globally, the coronavirus is the worst pandemic and public health crisis the world has seen since the 1918 Spanish flu. In Canada, we've seen over 150,000 cases and over 9,000 deaths, while Atlantic Canada, we have recorded over 1,500 cases and 70 deaths. COVID-19 has highlighted the fragility of our systems, as well as the massive expense of helping citizens maintain some level of economic stability. In addition to human toil, safety measures that have been put in place to protect communities and prevent spread have laid considerable strain upon people's liberties, livelihoods, and the economy. For marginalized populations who live with poverty and health inequities, the pandemic has been especially devastating. What's more, addressing a coronavirus outbreak amongst these groups will require creative approaches and extensive collaborations amongst many stakeholders. The COVID-19 pandemic has emphasized the challenges and importance of developing effective public policy in healthcare. Our goal with this partnership between the Dalhousie Faculty of Medicine and the McEachern Institute is to help decision makers in government and health authorities identify system and health outcomes for targeted improvement. Tonight's event hosts a panel discussion of Atlantic Canada's response to COVID-19 and features the chief medical officers of the Atlantic bubble. We are seeing cases of COVID-19 rise again in our country and in much of the world. In Atlantic Canada, with thanks to the incredible work of our speakers this evening, we continue to be very fortunate and have very few instances of infection. Tonight, we will hear why. Each of our speakers will give an initial presentation that will be followed by a live stream discussion open to the public. Tonight's viewers will have the opportunity to ask questions directly to Atlantic Canada's foremost experts in public health. As audience members, you may ask a question by writing it in the comments section of the Q&A panel on your screen. If you see a question that you like, you can give it a thumbs up. We ask that you write your name with your question, and if you're from a media outlet, could you please identify which outlet you are with? Please also direct your questions specifically to one or more of our 4 panelists. Welcome to our panel, and thank you very much for joining us for this special presentation. Starting things off, I would like to introduce our first speaker, Dr. Heather Morrison. Dr. Morrison was appointed Chief Health Officer for PEI in 2017. As PEI's first female Rhodes Scholar, she completed both a master's and a doctorate degree at the University of Oxford. Dr. Morrison returned to Canada to complete her medicine training here at Dalhousie University, followed by a residency in community medicine at the University of Toronto. Dr. Morrison has served in a variety of leadership roles, including chair of the Canadian Council of Chief Medical Officers of Health, PEI's representative on the Public Health Network Council of Canada, and PEI's representative on the National Special Advisory Committee on H1N1, COVID-19, Ebola, and on the epidemic of opioid overdoses. Dr. Morrison, what can you tell us about your province's approach to controlling the first wave and how Prince Edward Island has responded to the COVID-19 pandemic thus far?
Good evening. Thank you, Dr. Anderson, and thank you for inviting myself and our colleagues to be part of this panel. I think it's a good chance for all of us to reflect on the last number of months, and it's a good time as well as we head into the fall to think back, but also look ahead. And I think it's amazing that it's been now over 200 days since the World Health Organization declared the coronavirus a pandemic, and I'm sure that none of us would have predicted last October that we would be sitting here managing this type of pandemic. And I think even in March, I'm not sure initially we would have speculated that we would still be in a state of public health emergency or would be still making decisions that have had major impacts and continue to have impacts on our citizens and the economy. I know every day, and I've said this to my colleagues, that I remind myself, and I know they do too, that as our mandated role as chief health officers, it's to protect the health of our populations, and the role is not one about being popular, but rather about taking a stand to make the best decisions we can to protect the health of our populations. And so there are some tough decisions. And since the pandemic began, we've not always had the evidence that we would always like to have had before we made decisions, but we've made the best decisions we could at the time with the information available, and knowing that we've had to reconsider some of those decisions as we've gone along. So I've said, I often say here, we're on this journey together with Islanders and I think really more broadly in Atlantic Canada. And the journey is not always smooth or straightforward, and so we'll continue to do that. I think my children are usually saying, how much longer, and that's before we get to the bridge, the Confederation Bridge, to get off the island. And now they ask me, how much longer will this really be? And those are tough questions. So we've talked about the 4 C's, and I know we all talked about the 4 C's of how COVID-19 can be transmitted and some things we need to do. But I'm going to sort of talk about 4 or 5 C's here just to help me through the next few minutes. And they really are about compliance and collaboration, communication, and the challenges and caring. And those are the things that I feel like I've learned and that have helped us get through the last few months. And really, when we start with compliance and collaboration, one of the reasons I think Atlantic Canada is in this position and PEI is in this position has been a real compliance and collaboration with the public. They quickly responded and very rapidly to changing how we work, live, and play in this province and in Atlantic Canada. They, for a while, stayed at home. There were border measures implemented very quickly. And there was screening at our points of entry in PEI with pre-approval travel. And I think, we talk about the successes, and PEI certainly with that compliance and collaboration with the public, those border measures have made a difference for us here as a province, and I think also in Atlantic Canada. And as such, we also had that compliance and collaboration with the self-isolation. We put in place something called Operation Isolation, where we actually called people every day for 14 days for those who were required to be in self-isolation, which was and continues to be a major task. we've learned as well that early identification, along with the isolation, testing, and quarantine has really led to the success, and I think much more than just in Atlantic Canada, but right across the country. And I think we mentioned it earlier before we went live, that collaboration that has happened at the federal, provincial, territorial level has been really key in support and learning, and as well as our Atlantic colleagues. And we talk to each other regularly, we have calls regularly, and we look to each other for that support as a strength, as a source of strength and guidance. I know I certainly do for Drs. Russell, Strang, and Fitzgerald. And I look forward to our regular calls where we can discuss the issues of common interest and share our experiences. And I think that has helped Atlantic Canada as we have worked collaboratively as well, and really that has been invaluable. And I think the other thing, and I'm sure my colleagues will mention this as well, another success, or something that has contributed to our success here in PI, I think, has been that really the forging of very strong partnerships with colleagues across the health system and across the public service, across all levels of government, and really across in different communities across the province. And that's everything from our lab testing to working with the Office of Public Safety and Emergency Measures, highway safety. So those unique relationships with health, transportation, immigration, public health, nursing, private sector, and industries that we really did not have those connections with necessarily before. And I think that has helped us in a variety of ways, and whether it's at our borders or bringing temporary foreign workers in and putting guidance in place, and all part of a real strong public health response. And then the other C, communication, and I think we all may touch on this, but it's having a unified voice, and that's whether throughout government and with our Atlantic colleagues, and also having a voice that helps us keep calm in the middle of this pandemic, and it helps having that voice that if we're calm, will help us focus on the public health measures, and developing that trust with levels of government, but also, most importantly, the community and the public. And there are changing messages, they're difficult messages, and to try to communicate that has been really key, and being very honest and earning the trust that goes with that communication. And we've all, I know, shared moments with the public as we communicated that were really hard, that they sometimes were emotional, but I think they made it, and they make it very real and important. So, you know, we've mentioned some of the successes through that, and I think that early identification I talked about was testing. Now, I'm not sure if Prince Edward Island, out of the 4 provinces, it may have been the one that we were unable to do any testing, for instance, here when we started for COVID-19, and now we are able to do the testing here in our own province, and our capacity has increased tremendously, and so that has been an additional success. And the the role of public health, and has certainly been highlighted. And we spend so many years trying to talk about the importance of washing your hands, or the importance of vaccines, and going through the last number of months. I mean, those basic things have been really highlighted, and have also, I mean, those basic public health measures have shown they make a difference, not just here in Prince Edward Island, but in Atlantic Canada and much broader. So, but with that, I know we've had challenges, and it's taught us much about ourselves and our communities, and as we've had to adjust to the different restrictions, and we've witnessed firsthand the resilience of Islanders. We've also learned that reversing some of those restrictions has brought about new challenges, both from policy and operational perspectives. And the pandemic, I think, has highlighted that when some individuals are fearful or anxious about situations, they can respond in unusual ways, in ways that are not usual for them, and certainly not in a manner that we expect. So I think we've all would have experienced that as well. I think the pandemic has also highlighted for me, and we've learned this as well, that individuals and groups who were more vulnerable pre-COVID remain vulnerable. And the health and social inequities that we knew before COVID continue to exist. And public health must continue to focus on the groups who are vulnerable, and those who struggle with mental health and addiction issues, individuals who have barriers to employment, and these unintended impacts of COVID-19 have certainly, we've learned that over the last number of months, and they've been highlighted. So, until we have a safe and accessible vaccine or an effective treatment, we'll all be living with COVID-19 now. And I know that for all of us, it's normal for us to wish COVID-19 would go away and we could all get back to normal. But COVID fatigue is a reality here in PEI, and I think the other provinces would agree after this many months. And we see that COVID fatigue in individuals, we see it in groups, and we see it in our partners and our families, and we certainly see it in the public. So just to end, my last sort of C word is the lessons that we've learned really are about caring. The support of individuals and communities in PEI has been amazing. And the caring ingenuity of families and communities to support friends and neighbors during the pandemic are endless. And we saw groups coming together to support children who needed school breakfast and lunch programs. We saw farmers and other businesses come together to support low-income families. We saw individuals entertain seniors, long-term care via Zoom. And Islanders were supportive of welcoming friends and family throughout Atlantic Canada when the bubble opened on July the 3rd. So Islanders really have been very supportive and accepting of the public health measures imposed through the pandemic. And I think the last 6 months have confirmed, certainly to me, the kind, caring, and generous Islanders that are toward one another. And I don't think we would have managed this pandemic as well without that support and genuine caring, and that really that resilience that it evokes as we care for each other in the community. And I end almost every press briefing by asking Islanders to look after each other, and please be patient and please be kind. And so I think I'll end it on that same note at this point. So thank you.
Thank you, Dr. Morrison. Next, I'd like to introduce our second panelist, Dr. Janice Fitzgerald. Dr. Fitzgerald was born and raised in Newfoundland and attended medical school at Memorial University. After completing her residency in family medicine at Dalhousie, Dr. Fitzgerald moved back to Newfoundland and has worked around her home province as a family physician, spending much of her practice in long-term care facilities. Dr. Fitzgerald completed a master's in public health at Memorial before accepting a position as clinical chief of long-term care at the Eastern Regional Health Authority. Shortly after, she began working with the Department of Health and Community Services, where she worked in policy development for public health as the Regional Medical Officer for Health. In September 2019, Dr. Fitzgerald was appointed Acting Chief Medical Officer for Health for the province of Newfoundland. Dr. Fitzgerald, would you share with us, please, your insight on how Newfoundland has responded to date to the COVID-19 pandemic?
Thank you, Dr. Anderson. Thank you for inviting me and for organizing to the McEachran Institute for organizing this conversation tonight. I agree with a lot of what Heather has already talked about, and I think it certainly is a very important conversation that we need to have. So I think I'll start just by looking at Newfoundland in particular and sort of what worked there and some of the unintended consequences that came as a result of some of our measures. Certainly, I think I'd be remiss in discussing our response without discussing the role of a little bit of luck, I think, with regard to our situation, and part of that has to do with our geography and the fact that a large portion of our province is an island, and the other portion is a fairly isolated area of the country with very few ports of entry on the whole. So that certainly made importation of the control of importation of cases something not seen elsewhere in other jurisdictions, I guess. And I think a big break for us was that we didn't have a lot of travelers coming back right at the spring break time, because we generally take an Easter break, which was a little bit later. And so that certainly played a role in the response in Newfoundland and Labrador. But having said all of that, certainly there was a lot of hard work that happened. And to reiterate what Heather said, certainly not the least of which was the response from the people of Newfoundland and Labrador. And certainly, for the huge changes that we had to ask people to make with the initial shutdown and with public health measures and personal public health measures, I think, the people of Newfoundland and Labrador really stepped up to respond to that. And they gave us their trust. They gave us as public health practitioners their trust, and we are really forever grateful for that, because I think it made our job so much easier. I think in addition to that, what worked is fortuitously, we had a brand new Public Health Protection and Promotion Act, which certainly allowed for a rapid response to a public health emergency and allowed us to implement special measures orders. And again, as Heather had previously mentioned, allowed us to quickly institute quarantine measures for people returning from travel outside of the province, initially from outside of the country, and then very quickly after from outside of the province. And I think that had a big role to play in the response that we had. And the travel restrictions, I think, that we have in place really have, in recent cases, have certainly managed to keep those to single cases or family clusters, and that's been quite important in keeping our numbers where they are. I think, as we all have, and as Heather alluded to with regard to the cooperation and collaboration across the country through the special advisory committees that have been set up as a response, as a result of our response plan across the country, I think we learned a lot from other jurisdictions initially, especially with regard to long-term care facilities. So, looking at BC and Ontario and Quebec and the situations that they had and the responses that they had really helped to inform us how to keep disease out of our long-term care facilities and other congregational living facilities, which I think was very important in helping us to control the outbreak initially. And as well, our contact tracing expertise of our public health professionals in the regional health authorities was quite outstanding. And, we had some very scary times at the beginning of this pandemic in Newfoundland and Labrador. We had a large outbreak related to a funeral home cluster, and it was really scary initially. And I think that certainly went a long way to reinforce some of the messaging that we were telling people. But the contact tracing expertise was phenomenal in the Eastern Health Regional Health Authorities, which was where most of those cases were concentrated. And I think really they were crucial in helping us to control that first wave, so to speak. And that contact tracing ability has been phenomenal across our province, which we are grateful for. And I think, we do need to think about, though, and going forward, we need to consider some of the unintended consequences of our initial response to COVID-19. And, as Heather said, we did what we did with the information we had at the time. We made the best decisions we could, but we've learned a lot in the last 6 to 7 months. And I think we can now look at a refined approach going forward. So we do have to consider those unintended consequences, the economic effects of the shutdown, the effects on mental health, especially in addition to the anxiety of just the pandemic itself, but the actual impact of our measures on mental health, especially in long-term care and in children. We need to look at the effects of health system reorganization as we try to increase health system capacity. And, that amount resulted in procedures and tests and treatments being canceled or postponed. All of those have consequences. And again, having to call on other areas of government and redeploy people in other areas of government to deal with different aspects of our response, such as the border controls and monitoring, our travel exemption process, and many of those people are still redeployed into those areas. So these are all things we have to think about, I think, going forward, and how we are. And if we are going to be able to continue doing what we're doing, or if we have to modify that to some degree. But I think certainly, it was a huge collaboration on the part of government departments. It was collaboration between the Department of Health and the regional health authorities, with the public health lab, and certainly everybody stepping up and really doing what needed to be done, I think really laid the groundwork for us being able to have the response that we've had up to this point. I would certainly reiterate what Heather said about our regular CMOH meetings, Chief Medical Officer of Health meetings, but between the 4 Atlantic provinces and 4 CMOHs. I know for me personally, they've been a very important part of how I've dealt with this pandemic, and certainly relying on the support and the advice, sharing policy ideas, sharing policies and guidance and guidelines has certainly been helpful. Public health is, I personally am relatively new to public health, and I think certainly having this group of experts and this expertise to draw on has been invaluable for me personally. And I think there has been a lot of conversation and a lot of collaboration and coordination that has happened both between, at the Atlantic level, between people in public health and emergency management and emergency response, as well as with, the Public Health Agency of Canada, Canadian Border Services Agency, the Armed Forces, Transport Canada. All of these groups have had to come together to really develop a response to COVID-19. And we've forged new relationships with education in how we have developed a safe return to schools this fall. So all of these collaborative efforts have been really important in our response to COVID-19. And I think it's really important. I don't think it can be emphasized enough that we have really the FPT, the Federal Provincial Territorial Response Plan for biological events, I think really set the groundwork for how we responded as a country, and then how we responded as a province, as a region. And I think that was really important. We had a system in place. The system came together. It worked. That has been again a great resource for our province, and I think my colleagues would agree that these conversations have been really important for all of us, and I think the collaboration within government and the decision makers really deferring to public health in a lot of ways has been really important, and I think it's really given us a consistency in our messaging, which has been very important. And it has assured us that, for the most part, our decisions are being made based on evidence and science. And I think that's really important for ensuring that we continue to be able to ask the public for their trust and for them to be able to give it to us. And so I really do think that was an important part of the response across the country, and certainly in my own experience in Newfoundland and Labrador. And so I think, going forward, I think this collaboration needs to continue. And in fact, I personally would like to see it a little more formalized in Atlantic Canada, and that we have a mechanism in place going forward that will help us with planning and resiliency and thinking about public health in general. Again, reiterate what Heather said, we need to really carefully consider vulnerable populations. COVID-19 has really laid bare the inequities that that exist in our society and in our populations. And I think, we need to really work hard to ensure, number one, that our measures that we put in place don't exacerbate those inequities, and that we really work to reduce them moving forward. So we do need to look at some of those unintended consequences and really carefully consider vulnerable populations. So I think I will end it there, and I'll turn it back to you, Dr. Anderson. Thank you.
Thank you very much, Dr. Fitzgerald. I'd now like to welcome our third panelist, Dr. Jennifer Russell. Dr. Russell is the Chief Medical Officer of Health for New Brunswick. She's a graduate of Memorial University Medical School and completed her residency in family medicine at Dalhousie University. She served in the Canadian Armed Forces for 10 years and has worked for Veterans Affairs, Addiction Services, the Noreen Richard Clinic, and Horizon Health. She has been with the Office of the Chief Medical Officer of Health for the past 6 years and has been instrumental in educating stakeholders on substance use issues, hosting both the New Brunswick Opioid Summit in 2017 and the New Brunswick Cannabis Symposium in 2018. Dr. Russell, could you tell us and provide us with some of the details of New Brunswick's response to the first wave of the COVID-19 pandemic?
Thank you very much, Dr. Anderson, and thank you very much for having me here today. And somebody put this on my desk this week. I don't know if you can see that. Can you read it? Dr. Fitzgerald knows what it is. So it's from the Newfoundland Chocolate Company, and it says, "Stay in your own bubble and don't burst anyone else's. Dr. Haggie. I don't know who Dr. Haggie is, but I did enjoy the chocolate, and I like the message. We have the privilege to work together as these 4 Atlantic provinces, and I have the privilege of working with Dr. Strang and Dr. Morrison and Dr. Fitzgerald, and I respect them very much for the collaboration that we've done as an elected province group, and our premiers, I know, have had many conversations as well. So the information that we give our premiers and we give our governments, we're all sort of singing from the same songbook, and that information, that evidence-based information that we have been getting from the Public Health Agency throughout the pandemic has been key. Whether it's the documents that Dr. Fitzgerald was referring to, but all the documents since then, we have been able to tailor, and they encouraged us at the beginning, like, we will give you these guidance documents, but tailor them for your own jurisdiction with your own data and your own provincial needs and situations. So that gave us an anchor to start from in terms of here's the science, and then take the analysis of our data and our surveillance work and how we were seeing things unfold and apply it the way that we needed to in each of our jurisdictions. And you know, at the same time that we're getting all this great evidence-based information from Public Health Agency of Canada, including evidence-based information on risk communication, and in a pandemic, in any time of crisis and emergency, the evidence-based information that Public Health Agency of Canada provided on risk communication was around one message, one voice, up-to-date, transparent information on a regular basis, credible sources of information to get to allow the trust of the public to take hold, allow them to have that confidence, empower them with that information to make good choices, and have them be part of the solution and part of that collaboration. So in terms of the success that we've all had, I think we knew from the outset that we had to really try to stay unified in our messaging to prevent confusion and divisiveness. And certainly here in New Brunswick, we had the privilege also of having a COVID-19 cabinet that was an all-party COVID-19 cabinet. Representatives from each of the 4 provincial parties here, political parties, were represented. And so the conversations and the information and the evidence and the recommendations that our public health teams were recommending to the government could be vetted in that platform as well. And so again, when we would be doing our media press conferences, everybody again was singing from the same songbook in terms of, you know, we're trying to row in the same direction and move the province ahead with each of the big hurdles that we had to face. So at the beginning, making the decisions around closing the borders and implementing border measures and restricting non-essential travel, that was a huge undertaking. But again, with the evidence-based information around all the different measures that people can put in place, knowing that the stronger the measure, sometimes the stronger the consequence or the cost, and trying to balance those risks. And I don't think there's any jurisdiction in the entire world who's really succeeded in finding that sweet spot between the level of public health measures to combat the risks of COVID-19, as well as the unintended consequences and the negative impacts. So going through the first wave, we all learned together. We saw what we could do with those measures and how successful we could be with a lot of hard work, teeny tiny bit of luck, but lots of planning and that multi-sectorial collaboration with government departments, etc. So that learning at the beginning of okay, when we get to a point where we have to make some more decisions based on new evidence, what are the next steps that we're going to take? And because I don't know, I'm sure we all work with very dedicated, hardworking people, but my goodness, in New Brunswick, I feel like I have a dream team of people who are just like the Energizer Bunny, and they just keep going and going and going. And always trying to stay ahead of the next issue that's coming up, including the vulnerable populations, including, you know, opening of schools, and trying to navigate through each and every one of those particular challenges. And again, the collaboration with the chief medical officers of health from across the country at each stage, and then also our weekly conversations with our Atlantic counterparts. And prior to COVID, in terms of a structure and in the way we exchange information, that was already pretty pretty solidly put in place, including our conversations with ourselves among the Atlantic Chief Medical Officers of Health. We used to meet once a month. Now it's once a week. And same for the Special Advisory Committee made up of the Chief Medical Officers of Health. We used to meet once a month. For a while, it was every single day. And again, allowing that flow of information to keep informing our decisions at the provincial level. And coming back to the social determinants of health, again, I've got these really gung-ho people that, you know, when there was this little lull in the summer, instead of saying, okay, you guys take some weekends off, go home and be with your family, like, let's do some strategic planning. So here in New Brunswick, we ended up redoing our mission, vision, etc. goals for the Department of Health, integrating many more population health outcomes as opposed to health service delivery outcomes, and also in incorporating the language of population health and the social determinants of health. And now we're working on trying to look at evidence-based policies to support the social determinants of health as we move forward. Because as Dr. Morrison said, and as Dr. Fitzgerald said, the vulnerable population, they were vulnerable before COVID-19. And if we don't take this opportunity now to set right what should have been set right even prior to COVID-19, I don't think there's a way for us to successfully navigate through the pandemic. And I don't think we would feel good about ourselves as a province or as a country if we don't really put our money where our mouth is and put those policies into action that we know from an evidence-based perspective can work. Not to mention things about climate change. If we talk about the creativity and transformation and innovation that needs to happen at this point in time, yes, we could be living with this for a very long time if vaccines don't present a solution in the near future. So what does this mean while we're going through the pandemic, and what does it mean after, if there is an after? And what do we want to look like at the other end in terms of the outcomes that we'd like to achieve? So I think taking advantage of those opportunities and coming back to the bubble, having the connection with Public Health Agency of Canada, providing that anchor of that evidence-based information and the research and the science being vetted through that platform. We also were looking to other countries in terms of modeling and what success they had and what measures they put in place. And certainly New Zealand had great success early on with closing their borders, and we did adopt some of those types of things in our jurisdiction quite successfully. And so I think we've always been, again, trying to stay ahead of things as opposed to trying to catch up, because it's way more difficult to catch up as opposed to try to stay ahead. And some of the outbreaks that we've been able to conquer in Newfoundland, in PEI, and in Nova Scotia, we've been learning from each other that way, but also from other jurisdictions. And we're not finished learning, so we have a lot more learning to do. And I know we all want to work smarter, not harder. But certainly together as an Atlantic bubble, we feel stronger for it. And I think that the Atlantic provinces have always been a bit different from the rest of the country for many reasons in terms of geography, demographics, culture, economy, etc. So I think being able to work together has been wonderful. We don't feel so alone. And certainly I think we can all be proud of the work that we've done, and again, building on each other's strengths and whatever positive learnings that we've had, being able to share that information so readily and so comfortably that we have this great access to what we need to do to succeed. Building good relationships ahead of a pandemic obviously is a really important thing. In New Brunswick, we had only done really mock exercises for a nuclear disaster at Point Lepreau that involved an all-of-government approach. But as Dr. Morrison and Dr. Fitzgerald mentioned, that multi-sectorial all-of-government approach with the pandemic has really created relationships and connections that didn't exist before. And again, we're going to use that opportunity to continue down the path of a population health lens, an equity lens, and a social determinants of health lens as we move through the next phases. And so our red phase and our orange phase have been revised so that if we ever have to go back, the same triggers and measures will be in place in terms of what would cause us to go into those phases. But the severity in terms of, again, the unintended consequences around mental health have been taken into account as we look at what we would need to do in the future. And this is also also happening at the national level as well. So when we work with our partners at the national level, this is the same conversation we're hearing there. So the lessons learned have been on the clinical side and on the management side of COVID, but we're also learning about the things that we can do better and do more efficiently and more effectively in whatever waves we're seeing in the future, because we don't know how many waves there are going to be. So I think I'm probably out of time. I'm looking at my watch. And again, I just want to thank you all for inviting me. It is a pleasure to be able to speak about our accomplishments and our success with cautious optimism about what we have to face in the future. We in New Brunswick have the I guess the challenge of having Quebec to our northwest, and we have Maine to our west and south. So those two jurisdictions are having increased number of cases. We have border communities that are very, very close, and we've tried to have sort of little miniature bubbles that extend, you know, about 1 kilometer into those territories in the Quebec side anyway, because we do have people living and working on a daily basis, coming back and forth. And that's going to become more and more challenging as we move forward. So the issues around testing, we're looking at changes in our strategy there to accommodate that from the temporary foreign workers that we had, and also the international students. They self-isolated quite successfully, and we tested them on day 10. And so any of the positive cases that turned up during that time could not infect anybody else. And so that was very encouraging in terms of how public health measures can work so successfully. The difficulty is obviously applying that universally across the board, and again, balancing the risks and the effects that can have on the population and people's movement around the country. So we do know that the pain of not allowing everybody and their dog into our bubble does have consequences, and we don't take that lightly. And I'm going to turn it over to Dr. Anderson now.
Thank you very much, Dr. Russell. I'd like to introduce our fourth and final panelist, Dr. Robert Strang. Dr. Strang is the Chief Medical Officer of Health in Nova Scotia, appointed in August 2007. He received his medical degree from the University of British Columbia and completed family practice and public health and preventive medicine residencies at the University of British Columbia. As Chief Medical Officer of Health, he has provided leadership around the renewal of the public health system in Nova Scotia, as well as raising awareness around the importance of creating policies and environments that support better health for Nova Scotia families and communities. Throughout the COVID-19 pandemic, Dr. Strang has led Nova Scotia's public health response, acting as the province's spokesperson in the media since March, and continues to update the public regularly. Dr. Strang, tell us how you think the province of Nova Scotia has responded to the first wave of the pandemic.
So thank you, Dr. Anderson. Thank you to my Chief MOH colleagues, and thanks to the McKagan Institute for putting this on, and good evening, everybody. So a lot of things that my colleagues have talked about, same in Nova Scotia, but I'm going to cover just a few points. First of all, I want to look at how were we successful in limiting the spread of COVID-19 in Nova Scotia in the first wave. I think, as been talked about, there are some natural factors that are significant contributors and remain significant positive factors. One is our collective geography, Atlantic Canada. We are somewhat isolated with a much smaller number of border entry points, if you will, from both internationally and the rest of Canada. We do have a more dispersed, more rural populations, and even in Halifax. I mean, you know, Halifax is the largest city in Atlantic Canada, but we're still under 500,000 population. And if you look around the world and in Canada, where COVID is really having the greatest impact is in very large, very highly dense, large urban populations. So we don't have those in Atlantic Canada, and we really don't have the influx of large numbers of people internationally like Montreal, Toronto, Vancouver have. So we have some natural protective factors. We're also, I think people have talked about collaboration. The Council of Chief Medical Officers came together with the Special Advisory Committee. There are two separate groups, public health leaders in the country. Many of us sit on both groups, but very early on, in January, we came together and formed the Special Advisory Committee. And the advantage of that is we were able to see what was happening globally, and then to see what was happening in Canada. And we were able to, in Atlantic Canada, learn from from Toronto, from Ontario, from Quebec, from British Columbia, and apply the tight restrictive measures really before we had any amount of COVID-19 in our provinces. And I think that was critical, because once it's in your jurisdiction, it's much, much harder to control. So the FPT collaboration and the timing allowed us to get out ahead. But then when we really started to, our response in Nova Scotia was really built on three key areas. Our border restriction measures. So we still maintain, it was implemented March the 15th, and it is still in place with a variety of exemptions, that anybody coming into Nova Scotia has to undergo a 14-day quarantine period. And many of our cases, when I look back through the summer and after the end of the first wave, the vast majority of our cases were people who'd come into the province and were obeying the requirement to quarantine, and therefore they had few to no contacts when they were followed up by public health. It's to me, that's illustrative of the importance of, in a small jurisdiction with limited resources, protecting our borders. It remains critically important. We very quickly, and I have to give kudos to my laboratory colleagues in Nova Scotia, that we very quickly had developed substantive laboratory capacity. And I think one of the keys to our success in Nova Scotia has been we have not had the barriers to testing, and we were continuing to increase our testing capacity even now. And so we've been able to get people who needed to be tested very quickly. And we've had public health capacity to then do the appropriate follow-up with isolation and quarantining. Although I do have to make the observation that certainly during wave one, that public health, we stopped doing virtually everything else. Every single person in public health in the department, as well as in the health authority, was working on COVID, and it literally stretched everybody beyond the max. And so we have to recognize that while we had a successful response, we could not have done much more or gone much longer at the intensity that was required in wave one. And that is a lesson that we have to pay attention to. And I know my other colleagues were in the same situation in their jurisdictions. So we have to understand how fragile, while we had a good response, how fragile public health is and how stretched it was. The third arm of our response was really, as I talked earlier, about being able to implement strong public health restrictions early on, as well as being able to have a good communication strategy that really engaged the public. And I think we've had the vast majority of Nova Scotians have understood and agreed with the message that we are all in this together, and we have to do what we can do to keep ourselves, what I call COVID safe, not so much for us, but for everybody else around us in our community. And we've had a really strong community response about our collective need to look after each other. And so those are the things that we have to continue to pay attention to moving forward. The other thing, has been mentioned before, is that we've had extremely strong collaboration. When it's been necessary, our health system, which can have a tendency in what I'll call normal times to be somewhat siloed and fragmented, all that was put aside, and the health system has really worked in a very coordinated fashion. We had our large outbreak in Northwood, and every part of the healthcare system was put up their hand and said, what can we do to help? So that collaboration within the health system, but also across government. What people may not see is that something like which starts out as a public health event becomes a health event, very quickly became a cross-societal event, which required a cross-governmental approach. And behind the scenes, again, getting out of our traditional or normal governmental silos, and everybody, deputy ministers, ministers on down, just being willing to come together and say, what do we need to do to solve issues and to deal with problems? So I think, you know, how do we sustain that kind of collaboration? And I think for me, one of the successes in Nova Scotia has been able to been given the latitude to work directly with the Premier. For about 3 months, I was with him almost every day, and as a pair, being able to communicate to Nova Scotians, but also for me being able to have that direct relationship and have lots of conversations, and the Premier's commitment to always put the health of Nova Scotians first in all the decisions and thinking he had to do. And I think that's been a hallmark of our success, that the government has been seen to be caring about people's health first and foremost, and that's helped generate a lot of that public trust. So what we need to do going forward, I think we need to continue in those areas, but I think we have to acknowledge we've learned a lot more about how this virus is transmitted. We've also learned a lot about the unintended impacts of the very, the broad and very tight shutdown, which I firmly believe was necessary in wave one, but we have to understand the negative consequences. So moving forward, we have to have the same measures, but we have to use them in a much more evidence-based and nuanced response. So what actually works, now that we know much more about how the virus is spread, what are the type of restrictions that are needed and what are the ones that aren't so necessary? And when we do have to strengthen our public health measures again, our goal is to do that based on good local epidemiology, not to avoid, if at all possible, broad shutdown. So how do we focus our restrictive measures on a certain geography, a certain community, or a subset of the community, a certain subpopulation, or even certain specific settings, which we're seeing where the highest risk of transmission is. So being able to have a much more focused and targeted response, because ultimately, COVID-19, I use the word balance a lot. We have to learn to live with COVID-19. We could never sustain the lockdown that we had in the spring. So we have to tolerate a certain level of transmission of COVID. We have to tolerate a certain level of risk from COVID. And it's all about finding the balance. What is the necessary balance of COVID control? But also the right balance that allows us to minimize the harms from all the other the consequences that happen if we have too strong restrictions. I think we also need to understand, my colleagues have talked about equities, that moving forward, what is actually, frankly, the opportunity of COVID? It has given us to actually starkly highlight inequities in our communities. And what role can public health play in that? So ultimately, how do we do things that we create different models of housing for people who are homeless? Focus on affordable housing, knowing that many of the people who were most economically affected are our frontline service providers, in whether it's childcare, in the entertainment sector. And so how do we talk about actually making them less vulnerable for the next pandemic or the impacts of climate change by things like a guaranteed income? And then how do we look at things in the healthcare system that we things like virtual care and other, advances that are actually provide us a better access to care in different ways. And the last piece is, I'd be remiss without saying, coming back to that, ultimately understanding that help people see that ultimately our health is so much more than just access to health care, and that we need to find a better balance of a focus on health and all the determinants of health, and not just focusing just on, do I have access to a family doctor or a hospital? And then what is the role and how do we pay appropriate attention to have a public health as part of our healthcare system, but is also the part of the health system that bridges the gap into all those other areas, and make sure we have the appropriate resources, because this isn't the last pandemic. We have a ways to go with COVID, and everybody will say that if you look at environmental degradation and our interface in remote parts of the world between animals and humans, we have more pandemics coming. And I've read a lot about actually people are saying this is kind of the warm up for climate change, that the impacts on climate change are the same type of impacts we're going to see from issues we're having to deal with COVID. So let's use COVID as an opportunity. And I use the phrase, we're going to be different, but let's be better while we're different. Back to you, David.
Thanks very much, Dr. Strang. And I want to thank all of our panelists for sharing their experiences in their respective provinces. And it's great to see how you have worked together so collaboratively on Atlantic Canada's response to the first wave of the COVID-19 pandemic. So with that, we're now going to move into our question and answer portion of the event. And again, you can write your questions, as many of you have been doing for the past hour, in the Q&A portion of your screen. We will not get to all your questions tonight, but we will get to as many as we can. And again, if you do want to direct your question to one of our speakers, please indicate that in your question. So I'm gonna get started, and not surprisingly, there are lots of questions about the Atlantic bubble. So I'm gonna start with a couple of those, and maybe I'll ask the first one to Dr. Fitzgerald. And Dr. Fitzgerald, the question that's coming up is, we're all living within the Atlantic bubble, but why are provincial guidelines around the protective measures against COVID-19, why do they differ from province to province?
Thanks. Yes, and that's a question we frequently get, certainly. And I think, you know, as we've alluded to previously, any of these measures have to be contextualized to your own local epidemiology, to your geography, to your vulnerable populations, and so your public health capacity and healthcare capacity. So we do have to consider all of those things when we're making a decision about, you know, what the group size can be, or mass gathering size can be in your province versus, so, you know, it may be different from one province to another. So I think we have to take those things into consideration, and it's not just simply about, okay, we can, because we have no cases, we can pick a gathering size of X number. We have to look at, you know, well, what would be our capacity to respond if we had a large gathering that had an outbreak, and those sorts of things. And those are all the things that we have to take into consideration when we're making some of these decisions. So certainly would appreciate anyone else's comments on that, but that's, it really has to do with a local response that's more than just what our numbers are, really, case numbers.
Okay, thank you, Dr. Fitzgerald.
Rob, maybe I'll add to that quickly. And we all have different policy contexts within which we take our advice forward. And there's different things, policy, small politics things going on in each jurisdiction. And I think the last thing to pay is that there is no rule book. There's nothing that a textbook that I can go to and say in a pandemic, this is the appropriate gathering size. So we all try to look at all these factors and say what actually makes sense. And there is no absolute right or wrong. And so all that contributes to some of the variation. But we do work as hard as we can for national and regional consistency. But all those other reasons that we've talked about lead to some of that variation.
Okay, thanks very much, Dr. Strang. For Dr. Russell, you know, with the way things are going at COVID-19 across the country, this may not be the greatest time to ask this question, but what about the Atlantic bubble? Is it going to come down at some point, and what will inform that decision about opening up travel to the rest of Canada?
Well, Dr. Anderson, in the summer, it was looking better in terms of, you know, being able to relax some of those border measures. But with the numbers going up, you know, in Quebec and Ontario and BC and other jurisdictions, we were not really in a hurry to have that conversation. So, but in terms of when we do have that conversation, the types of things that will be informing our decisions will be, again, the risk. So if we're seeing the number of cases go up substantially, if we're seeing community transmission, which we are seeing in Quebec right now, It really, in fact, recently we had to kind of tighten up the agreements that we had with 2 neighboring communities already. So there's already been some changes based on that risk. And again, because we have really provided exemptions for the people that live and work just outside of the bubble, again, with work isolation and some testing depending on where they're working. But for the rest of the country, and in terms of people who are traveling for non-essential reasons or the other things that you can be exempt from, again, it will be based on the data that we're seeing, and the trend is not looking overly positive at this point. But we will continue to monitor and continue to have the conversations, because obviously, because the other thing that we are aware of is that if one of the Atlantic provinces has an outbreak, that we'll be relooking at reestablishing the border measures in between the Atlantic provinces, which we don't want to do either. So the collective need to keep the Atlantic bubble as protected as possible from outbreaks, again, because of what Dr. Strang said, our resources are so limited, and the outbreak that Nova Scotia dealt with, and we had an outbreak in the northern part of our province, which involved a hospital, 2 daycares, and an adult residential facility, and it did require a lot of resources. So, and I think that particular outbreak resulted in probably 45 cases in total, but I think there were about 400 close contacts, and that particular part of the province had to go to the orange phase, etc. So there's many complex pieces to and many moving parts that you make a decision in one area that will affect a larger area. Back to you, Dr. Anderson.
Thank you very much, Dr. Russell. Questions are coming up about vaccines, and is it going to take an effective vaccine to get us out of this situation? And when a vaccine becomes available, how is it going to be applied? How are we going to make decisions about who gets access if its supply is limited? And Dr. Morrison, maybe let's start with you. What are your thoughts about a vaccine? Is it going to take a vaccine to end the dilemma that we're in, and thoughts about how to apply that going forward?
Absolutely, lots of questions about a vaccine and also treatment of COVID-19 as we look forward. Nationally, there has been discussion and really some decisions around when the vaccine becomes available, that there would be certain priority groups, and that would perhaps be able to, if there was a limited supply of vaccine, who would receive vaccine first. And some will depend on which vaccine is actually produced and available. There's discussion there'd be a number of vaccines possibly available at the same time. But for instance, if the vaccine is safe for seniors, and we know that the seniors are particularly impacted, it would be that kind of vulnerable group that we would want to make sure is a priority group. And having some consistency across the country of identifying those priority groups will be really key in going forward. I think some of the vaccine is certainly important as we go forward, but it won't be the only thing I think that we have to think about in the year ahead. There will be some of our other public health measures and things that we've learned and will continue to learn about this virus will be important. And I'm not sure we have discussed as other Atlantic CMOHs when we all think a vaccine may be available, but I'm thinking it may be this time next year before we are able to have a vaccine for our Atlantic Canadians, but remain hopeful. Of course, it could be earlier.
Okay, Dr. Strang, lots of questions about testing. And first of all, what about point of care testing and some of the tests that don't involve nasopharyngeal swabs? How close are those to becoming readily available, and when, particularly point of care testing, when do you think that should be used?
So that's a very active point of conversation right now. People are probably aware In the last week or so, the federal government announced, I think it was about $7 million of purchasing point-of-care kits. I think within the last 24 hours or so, they've been licensed by Health Canada. I think what we need to understand, though, is with all these testing methodologies, before we can actually use them on the front line, they need to be validated by our labs. Just because they've been licensed by Health Canada doesn't mean they're actually valid tests. And we had an example back in the spring by a different type of testing technology that was approved by Health Canada. And when the labs across the country went to actually use it, it was actually didn't give reliable results. So we can't let the science the marketing get ahead of the science on these. But I think we're getting close there, and so we've started a discussion in the next week or to 2 weeks around how we might start to use these point-of-care tests to supplement our nasal swab PCR tests. We have to understand that the point-of-care tests are naturally going to be less reliable than PCR tests, and any positive would have to be validated by a PCR test as well. So they are, again, like the vaccine, they're not a golden ticket, but they're one more piece in our toolkit, if you will. But we have to make sure that we have this; they're scientifically valid. And then, as I say, we're all working now to figure out how do we fit them into our overall testing strategy.
Thanks very much, Dr. Strang. Dr. Fitzgerald, the concerns about just availability of good information in the public domain that people can follow to get accurate, up-to-date information about do's and don'ts around COVID-19. What do you advise people about that? Where should they get their information when they have questions around the COVID-19 issues?
Thanks. Yes, and a very important question. So certainly we recommend, and I mean, I think I speak for all of us when we say we recommend that you go to reliable sources for your information. So you want to make sure you're looking at your provincial government websites, the Public Health Agency of Canada websites. Certainly other provinces also have good information, although it may not be applicable completely to your province. So you want to, I think, first and foremost, go to your own province's website. Other reliable sources, of course, the World Health Organization, and we certainly need to encourage people to seek out those types of information. Relying on social media, there's certainly a lot of misinformation that can happen through social media. And you often don't know if it is a reliable source that you're getting the information through. Sometimes it is, but it's not always. So you do have to be to have certainly some skepticism or at least awareness, I guess, awareness of what you're reading, and to ensure that really, if you're reading something on social media, for example, I think. And you're wondering if it's true, I think it's really important then to check that with a reliable source to see if indeed it is true, and ask questions. Sometimes your own healthcare provider can give you some answers, and if not, they may be able to point you in the right direction as well. But really relying on reliable sources is really key in making sure you get accurate, up-to-date, and reliable information.
Thanks, Dr. Fitzgerald. This might be for any of the panelists, but I'll start maybe with Dr. Russell. Is Atlantic Canada prepared for a second wave of COVID-19?
Well, I think based on all the preparations and the learnings that we've done, we would prefer to avoid a second wave. And obviously, every single amount of cooperation and every single human being that lives and travels to the Atlantic bubble, if they continue to do their part, then hopefully we can avoid a second wave, and we can see small outbreaks that are contained in a short amount of time with the fewest number of people involved and the fewest number of people affected. At the beginning of the pandemic, when we were in the early stages in March and February, we did modeling exercises to see what our hospital system could handle. We made arrangements to make sure that that hospital capacity was there, the hospital bed capacity, ventilators, etc. And living through that first wave, again, we knew we had those things available if we didn't go above a certain number of cases. And so we do know what that threshold is, but having, as Dr. Strang said, after being through that first wave and an outbreak since then, knowing what resources are required, you know, we've only had 2 deaths in New Brunswick. We've only had a small handful of people who had been hospitalized and ventilated. And you know, when we projected, okay, well, if we had to use 300 beds, or I don't even remember what the number is now, and so, you know, I think we had 250 ICU beds. I cannot imagine what that would translate into in terms of the public health side of the contact tracing and the self-isolation, let alone what that would do to the economy, because with numbers that high, it would be impossible for us to stay in the yellow phase. So we have a huge vested interest in continuing down the path that we have been so far in terms of successfully avoiding big outbreaks and a surge right now. But one of the regional medical officers of health was talking about a situation that she was dealing with, and again, as the numbers increase in the areas around us, it becomes more and more and more difficult. So I don't think we'll be able to avoid the wave entirely, but my goodness, we really, really have to be able to manage it aggressively if and when we do see an outbreak. And again, individual cases here and there we dealt with all summer. Those people were self-isolating, and that's where we would love to see everybody be self-isolating for 14 days, and then we wouldn't have to worry. But having a society and an economy that is open enough to allow, you know, a healthy amount of interaction and business, again, we won't be able to get away from the risk in terms of, you know, the risk will never be zero. And certainly our risk tolerance is very low as an Atlantic bubble for good reason. And again, we can only be cautiously optimistic, but be realistic at the same time about, you know, the next, you know, 6 months for sure. Certainly while the school kids while school is in, I feel like the next 6 to 9 months are going to be the challenge. Let's get through the school year. Let's get through Christmas, see how things go. But again, each phase brings with it new challenges. So we got through the phase of getting all the university students here, and now, you know, with people wanting to travel for holidays like Christmas, then what is that going to look like? So we're having those conversations about how to do things safely, because we're not trying to tell people to not do things within the bubble. We're trying to tell them how to do them as safely as possible. So gatherings are becoming an issue in other jurisdictions, and if we were to see an outbreak, if we were to see community transmission, these would be devastating. And so I think we're going to have to continue to amp up our messaging of things that are already in place and incrementally work at being creative about where else can we tweak things to, again, make things that are in place already even safer. Back to you, Dr. Anderson.
Thanks, Dr. Russell. Dr. Morrison, can I ask you about other public health measures like flu vaccines, and how should those continue during the COVID-19 pandemic, and what just recommendations in general about other aspects of public health and how to make sure that those messages get across?
I think all of us have been dealing with influenza vaccine and promoting that influenza vaccine, and I think the media referred to the fact that we don't want to have a twindemic. I think I heard one media outlet talk about it, where we have a big increase in influenza at the same time we have a potential increase in COVID cases. And so I think influenza vaccine is really important. It is a public health measure. It's annual vaccines. It has similar type symptoms to COVID, and so it will be important to minimize the complications related to influenza and reduce your chances of getting influenza. I think some of the other public health measures that we were talking about with COVID are really key for influenza season as well, and just respiratory viral season, with washing our hands, staying home when you're sick, try not to touch your face, cough etiquette. Those are things that are always part of our public health discussion and recommendations during influenza season, but they seem to really have made it really key this year as we're trying to protect not only against influenza but COVID. We know that Australia actually had really a limited influenza season, and I think it was really in part due to some of the other public health measures that were in place for COVID, and I'm hopeful that that may also be the case here. And we don't want to overwhelm. Dr. Strang spoke about that public health and health system link, and certainly our hospitals are easily overwhelmed during influenza season, and so we certainly don't want to see that being overwhelmed with influenza if we're also having a big outbreak or increased number of cases of COVID.
Thanks, Dr. Morrison. Dr. Strang, with the relatively low rates of COVID infection in our part of the country, understandably there may be a bit more COVID restriction fatigue than in other parts of the world. And how do we manage that? How important is that as a phenomenon, and particularly if worry about avoiding a second wave of infection?
So I think that's critical, David. And so I think some of the things that Dr. Russell just talked about, we have to remind people that the reason we're as safe as we are is because of things we've all outlined, and we can't. Now is not the time to relax. And if you just look around us, in fact, it's a time that we have to make sure we're staying. We may not need to strengthen things yet, but we certainly need to be very vigilant about keeping at the level of restrictions on gatherings, and especially social kind of events, as well as having everybody as much as possible doing their own personal protective measures. That remains critically important. And I think we have to help people to see that that's how we keep ourselves in this safe space. And that it's what will minimize the chance of having large spikes in numbers, which then overwhelm us all. And I think even there's a lot of people saying, well, from the economic perspective, that why can't we be more relaxed economically? But I think we have to take a longer term view to this. And actually, one of my deputy minister colleagues, the deputy minister of business, Bernie Miller, he says we need, this is the mantra: good public health is good economics. And so actually, if you look at the data that he looks at all the time, and I've looked at it with him, is actually if we stay very tightly restrictive and get through the next 6 to 9 months, we're in a position to actually be in an economic recovery much sooner than many other jurisdictions who have been overwhelmed by large spikes of waves of COVID. So I think we have to help people see, even from an economic perspective, that staying very tightly controlled for the short term actually puts us on a better footing economically, let alone the health pieces. And I think if we can help people understand both of those, both from a health and an economic perspective, it's too soon to be relaxed. I think that's where we need to focus and help everybody understand that. And having everybody positively engage with that will be critically important to, because at the end of the day, me, my colleagues, we can say things, we can have restrictions, but ultimately it all comes down to what is the willingness of our citizens to actually listen to that and do all the things we're asking them or requiring them to do.
Thanks, Dr. Strang. I regret that we're coming to the end of our question time tonight, and this is going to be the final question, and I'm going to give it to each of our panelists, and would ask it about a minute or so to answer just this question. So, you know, there's been a lot of, I think, really positive things said about public health officers in Atlantic Canada over the last several months, and there's so much appreciation, and you can see it on the chat tonight about the work that you're doing. So the question has come up: from your perspective, what's it been like to have been a public health officer responsible for a province in the public health crisis of the millennium, just like to get your thoughts as how it's been for you personally and how you've managed during this just incredible time for our world. So maybe Dr. Fitzgerald, I'll start with you.
That's a big question. It certainly, I think, it's been a lot of things. There's been a lot of emotions associated with it. It's been overwhelming at times, for sure, especially early on. But it's been very rewarding as well, in that, you know, it's just so rewarding to see how people have stepped up and how people have put their trust in public health. And it's been absolutely fabulous to be part of such a wonderful team and such a dedicated team, who in our province have gone above and beyond, who in Atlantic Canada have gone above and beyond, and across the country. It's really been amazing to be a part of this group of professionals. But you know, it's something that very much a team effort. It's something you could never do by yourself, and I think it would be wrong to think that it had anything to do with me personally as much as it has to do with the team that's behind me.
Thanks, Dr. Russell.
Well, I echo what Dr. Fitzgerald said. I have an amazing group of people that I work with every day, and I could not do what I do without their support, as well as my colleagues across the country and my Atlantic Canadian colleagues. I think obviously we've learned a lot about ourselves and about our provinces and about the resilience and cooperation and community and sense of responsibility to each other in looking after one another and that level of compassion. I think it's been a historic event. Again, when somebody said it had been 6 months since we imposed the mandatory orders in the Emergency Measures Act, I still remember that day about to go into the press conference and realizing, wow, this is a completely new thing that we're experiencing that is historic. So lots of learning, and I think the other piece I've been preaching to some of my colleagues, and you, the Atlantic Canadian ones included, is to look after yourselves and make sure you fill up your cup of energy and we get replenished so that we can keep doing what we have been doing successfully.
Thanks, Dr. Russell. Dr. Morrison?
Yes, maybe just picking up on Dr. Russell's comment there at the end, I think what it's been like is I think it's been tiring and exhausting, but at the same time rewarding. I feel grateful to the public, to the support we've had through a government and the community and the team. I think they both Dr. Fitzgerald and Dr. Russell spoke about the amazing teams they had, and we do it together. And I think I mentioned as we started, we're on this journey together, and we will continue this together, and just always keeping the health of our population in mind. And so it's I think it's hard, but at the same time feeling grateful for the privilege to try to look after Islanders, in our case, in Atlantic Canadians for all of us.
And thanks, Dr. Morrison. Dr. Strang?
So yeah, I mean, it's certainly very. It's two sides. It's very challenging. You know, professionally, a lot of stress, but and then a lot of stresses on family and personally, but at the same time also incredibly rewarding in terms of being in this situation. This is what we trained to do, this kind of work, and at a much lower level, it's what we have done every day in our careers, is do what we can to help serve our people and our citizens, and really humbling as well. When I see, you know, I try to focus on my messages to Nova Scotians is about care for each other and build compassionate communities. And to actually see that how many people are doing that in so many different ways, and people reaching back out to me and my family, that the messages of support in my own community, my own church community, how my family's been taken care of. It's actually really humbling to see how we're being looked after by our fellow citizens, and how they've taken their own responsibility and understood that we all are in this together.
Thanks very much to all of you. So thanks again. Unfortunately, that's all the time we have for tonight's event. I would like to thank our speakers again for being here and for their thoughtful remarks and insights. I know it's a very busy time of year for all of you. And to everyone watching us, thank you for joining us. A video of tonight's panel discussion will be shared on the McEachern Institute YouTube channel and the Dalhousie Faculty of Medicine website. So thank you again, good night, and stay well.